And now it's my honor to introduce you to Pat Montoya. Pat is president of the National Not One More chapter.
Well, I want to introduce you guys to one more person. Just last week, we introduced our newest chapter, West Virginia. And it's Paula Riggs right here. Wave at us, Paula. So she's a mother as well, and she has quite a story. But we're always looking for support that we do around the country like this. I am a father of an addict. My son has, using the proper term, the substance use disorder. He's in my house right now, so I'm going to be a little quiet because he just popped up yesterday morning, and he's on my couch right now. But how many parents we have out there? How many parents? With the show hands, yeah. So it just, we know what we've had to go through, and I feel, my wife has gone through the same thing, the heartbreak, the frustration. In the very beginning, boy, we were against each other. We didn't know which direction to go in. We were watching something manifest, and we had no idea what it was that we were watching. We didn't know the magnitude of it until the police brought him home at 16, 15 years old. And, and it was like, we still were trying to figure things out. So 8 years ago, we formed this chapter of Not One More, and it kind of blew up into, I think we got 15 chapters now, with Paula being our newest one. But we're just parents, families, and friends trying to understand this whole mess. I put on some things out there. I go, there's no right or wrong answer to how we do this, because what we see is for what works with one person or child doesn't work for the other people out there. There's the underlying issues that we have to deal with as well: mental health, trauma of all kinds. Split families. When we go to schools and speak, we ask the kids what their biggest problems are in schools, and what drives them to possibly pick up and use or self-medicate, maybe smoke a cigarette or a vape or whatever it may be. I do believe in gateways out there, because everything has to start somewhere. So and our brains, the adolescent brain, we're watching our kids, it's the pleasure, the pleasure part of the brain that we're watching, that they do it, and they keep on trying to, elevate that and trying to find that same, as they say, chasing the dragon, trying to find that same pleasure that they've had when they first tried anything. So, as a parent going through this, as a father going through this, as parents, we try to stay together. We try to, work it out. And sometimes we find that part where we don't come together on it because one parent's tougher than the other. I'm a very forgiving father, and my wife's the tougher one. But just watching our son go through this, and we've had to learn a lot. It's the only way that I can speak about it is using my son or having my son as my educator. I could read all kinds of stuff, but watching him and having to go through it, the ODs, him being high, or even the family violence that follows that. The stealing from us. I think everybody probably is around the same area. If you guys have or had an addict in substance use disorder, that we just watched it manifest from our good kids that played sports. My son was a football player in high school, and did everything that we thought was going to just be the normal way that people raise their kids. I got another son that's that goes to college, and he does coach at a high school, and he's 23, and my other one is 28, and he took a different path. So what we try to encourage parents is that we are not to blame for what our children go through, because obviously, like what I just spoke about with my sons, we raised them both the same way, but yet one took a different path than the other. And that was, kind of hard to, to watch, learn as parents. What I found out though, when we first started, very few men were involved with this. Because we always have that tough attitude, the man's supposed to be in charge, blah blah blah, and do that, and that's nothing against women, because the women are the strongest ones, and they're usually the one that have to bear all of the heartache and the trauma that goes with watching our kids go through this. But when I used to go to meetings, it was probably 80%, 90% women in the meetings. And I go, well, where's your husband? Where's where's the kid's father, or whatever, or whatever it is. And they said, well, they don't want to come to this because they don't think it's their problem. And I don't see it like I said earlier, I don't think it's our problem that they started in their addiction, but it is our problem because I do think it's a family addiction that once we get started in it, that our kids, bring us into that. And the harder we push that away, the harder it gets on the family. The family unit starts falling apart, and all of that. And you always see, a lot of people that get, divorces or whatnot. And we've gone through that, here in our household. But, like I said, going back to the father thing, I just didn't have the support of other fathers out there as much as I wish I had. Because we have the same emotions as moms. We didn't give birth to our children, but I love my son just like my wife loves my son. I cried the same tears. I've been up with him all night. I've been I'm usually the one that's with him when things are going pretty bad, and I kind of protect the family from anything else that goes on with my active son out there. So, the hardest part is being a father, going through this, having to educate myself, and then try to make other fathers understand that this is a family addiction, and it's okay to be involved with this. And we have to be there as a team, with our significant others, so that we can, help battle this. Just like an addict, when they try to get recovery, we know that they can't do it by themselves. Just like that's what parents have to go through too. We can't do this by ourselves. And if we do, we know the chaos that follows behind that. And so one of the biggest things was me being, right now, I have 7 board members, and 2 of us are men, and and one of them is one of the original board members. So not very many men will come and volunteer to go out and do what we do. Most of my speakers are women out there. Very few fathers will come out there and tell their stories. I'm one of those that can get out there and say, talk her story. I mention that Not One More has been around for 8 years, and like I said, we started with parents, families, and friends that were watching things change in our communities. And oh, by the way, I'm on California. I'm on the California coast, just to let you guys know. So we don't have a lot of resources out here. And that's what we battle with is the resources. When our son first got into this, there was almost no resources out there whatsoever for rehabilitation for an adolescent, because he was, I think it was 15 when we put him in his first rehab, and they put him in an adult place. The only place that they had out here was an adult rehab. And, and to me at that point, we fed him to the lions, because he learned a lot of things in there that, I don't know. It's just that, we, as parents, we sit there and wonder if we did the right thing or the wrong thing, or, and as a parent, we feel guilty at times. And, that's one of the hardest things is having to go through that and wondering if we're making the right decisions or not. Once he became an adult, I had to push away. There is nothing more I can do. Here in California, we have a proposition called Prop 47. It's a catch and release. no matter, unless you're a big dealer, no matter if you have whatever drugs you have on you, you get a citation and they release you. And then you have to just show up at court, and it's a misdemeanor. There's no more felonies on drugs out here. I know Oregon just passed a law. I guess it was a law, I guess, in Oregon where they made it legal for all small quantities of drugs. So they're not even going to cite them. They're just going to, hopefully have some recovery or something like that for them out there. And that's the biggest thing, is trying to find recovery places for our kids out there. I don't know. It's just, some of the things that we've had to endure. And you guys as parents, I'm singing to the choir. One of the biggest things though is when I go to schools, they ask me, who do you want to speak to? I go, I want to speak to the parents. I want the parents to be here. I want, the students know, because they're the ones who tell us what's going on out there. And I want to speak to the parents. So as a father, when I go in there and do the speaking, a lot of people go, wow, my husband would never get involved, and things like that. It's always the wives or the girlfriends or somebody else like that get involved. And I'm one of the few fathers that, and been blessed to run this organization and mentor my other chapters to, come in. You could ask Paula, it took us like 3 months to get you on board here. But, I told her I like to work on it, because by the time you get started, we're going to hit the ground running, and that's what we're doing. And that's what I expect of us is, we can't just get on Facebook all the time and just chat out, what we feel and stuff and singing to the choir once again. But we have to get out there. And like I said, I call it boots on the ground. We have to go out there and tell the people who aren't aware of what's going on, but it is affecting our communities. And that's one of the things we started here was we started with our city council, our city leaders here. We started the task force on heroin prevention. And that led to the school district, all the heads of the school district, park district, churches, city, the chamber, all these people came, the leads of these groups came in, and we all were, like think tanking. And once every 2 months, we'd have a meeting at the city hall, and we'd all give a report on, what we were doing to make changes out there, whether it just being, making information available, or, like our school district. And you guys probably had the same things going on out there when if you ever try to get into a school and speak. They're in total denial that there's drugs in the schools, and the students tell us they're scared out there. They don't want, they know what's going on in the campuses, the ones who don't do drugs or whatever. And so our school district actually made a web page with all these resources on it that, was there to help guide parents. Because like I said earlier, when I first got into this and my son was in high school, there was no resources out there for us. And that's what we had to try to do is try to make people or have people, make these changes. And it's just a matter of putting information out there, As a father going through this stuff though, it's been tough, a lot of emotions, come out. I go back and forth with it. We get a PTSD, I think that's one of the things I see with parents when we go back and forth with this. And finally, we actually get that mental condition called PTSD where you hear the phone ring or a siren or something like that. We're jumping out of our skin trying to do that. I've gotten in my car and actually chased sirens around thinking, knowing my son was around, just, I don't know what I was going to do, but, and I've walked up on ODs out here where the police wouldn't let anybody in, but they knew me. I go, can I just go see, I just need to go see, and it was, thank God it wasn't my son, but it was, at that point, but it was somebody they were reviving out there. And it was just, it's horrible, it's horrible. So, as being the father part of it is, we got to kind of keep our families together, but we also got to work in teamwork. as far as what I do in the community. I just had to be a big, loud voice and, not let people, say that this isn't happening in our community when we had so many people, getting, our overdose counts aren't as high as they are back east. Pennsylvania, I know you guys have a tremendous amount of people you're losing out there. Um, our numbers are, way lower than that, but one life lost is one life lost, and to me, that's what matters to me. Some of the things we were able to do, this year or 2 years ago, we were able to get grants for giving out Narcan. We're getting free Narcan through the state through a grant program they had, and we're handing that out. But it's really weird because I don't know if you guys ever run into this, but a lot of people don't take our Narcan. We offer it up, we give classes, and a lot of people won't, come and take it, but they'll come on Facebook and tell us about, their kid being in active addiction or the kids being on there, or one of the things with our Not One More chapters, we try to bring everybody together, the active addict or the recovering addict, the parents, even the community members, our mayor, even some people in good, upper standing in our community, they're on our pages so that they can understand what they see the parents going through. One thing is we're not afraid to talk about what we do. We're not afraid to put it out there. And, we've done our walks. I've gone to schools. We'll go to public events where people, I don't know if you guys ever had this problem either, if you've done a public event that is not related to what we do, but we'll go to like a big chamber mixer thing, and there's not one more, and people are, it's like there's 15,000 people there, and people like are looking at us like, what is this about? People used to think we were promoting drugs, and we were furthest from that. And, people thought we were going after doing police work, when it was, that's the police's job. That's not my job, but my job was to try to save lives, bring families together, and make sure that, our community had something better to go off of here. So I don't know. It's just, one of the biggest things that I get to speak in as a father, I go to the juvenile probation department. In our county here, we were invited. They read an article one time. They called me up. They said, "Hey, can you come out and speak with us?" I go, "Yeah, I'd never done that." So I went out there and spoke with them. And now we've been doing it for 2 years straight. Once a month, we go into their, the juvenile probation. It's a diversion program. So these are first-time users. These kids get caught at the parks, or school smoking weed or drinking beer or doing something. Some of them are into little hardcore drugs, but none of them are really in the substance use disorder part of it yet. They are just, I call them users. They're out there, it's, having fun with their buddies and stuff. But then at that point, I tell them, well, now you dragged your parents into it. That's why we're all here. Because at the juvenile probation thing, they have to bring their parents as well. So for 2 hours, during all sports things, it's sometimes it cracks me up because there'll be a playoffs or something like that, and the parents are trying to, they're sitting there frustrated. And I go, see what you're doing? You guys did this, all on your own. If you don't think this affects anybody, then you're wrong, because once you got caught, now your family's involved with this. And this part is the beginning of your family addiction. If you continue to go on where you were at, you will find yourself in our group, and I told them, I go, I don't want you to be in our group, by needing help or even, grieving. We have another Not One More site called Not One More, the Other Side. And it's for parents that have lost, or parents, families, and friends who have lost somebody, in any form, suicide. We're seeing a lot of that right now going on with this COVID thing. We're seeing a lot of relapses. I'm getting a ton of phone calls, and you think it's hard to get into recovery now. Now the rehabs are even limiting on the people they're taking in now because of the COVID thing. They're limiting time, and they're not accepting new clients, and it's a sad fact that we have to sit there and basically watch watch these kids go through their addiction and not be able to receive help. I mentor a lot of youth kids. I go, I let parents know, because sometimes when we talk to our own kids, they don't listen to us. And I think we can all agree to that, they don't listen to us, but we can go talk to another kid and they'll listen to us. So I do a lot of that where a parent has that same problem. Their kid won't listen to them, but when I go take out and listen to them, and talk with them, the kids will listen a little bit, and we get a little more reaction from that. I think my size is a big size. I'm a big guy. I do bodyguarding and security for celebrities and stuff like that, bar bouncing. At my age, I'm doing that. I like to do that. It keeps me busy. That's one of the things that I tell parents to do too, is get busy. Get busy out there in your own recovery, because if you don't, you sit there in the house and just wonder what's going on. And like I did earlier in our own recovery, was watching, we were just sitting here, just waiting for whatever. Hearing, like I said earlier, the siren, the knock at the door, the phone ring, blah, blah, blah. And it just started getting to us, and it's a real mental head trip that we all have to, we endure as we're going through that. But that's part of the growth of us learning our own recovery. And I do work at another rehab on Monday nights, and I run a family in addiction, a families in recovery meeting. And, that's young addicts in recovery and their parents, and they bring them in. And sometimes, just parents will come in just to try to understand what's going on. And we always try to, make them understand, their own recovery in this. And once people start getting their own recovery, and going back to the father thing. So here's the thing about the fathers: they come in there with their arms crossed, and they don't want to, they're like, we're tough, and this is the way the law is going to be, and this is how I run my house, but it's chaotic, and they don't, it's amazing to see what drugs do to a household, so we try to soften up those dads, and bring them in, and tell them it's okay to love, and it's okay to cry, and it's okay to not have all the answers. I don't think there's anybody here that has all the answers, because if we did, we'd all be able to, we'd have a solution to this whole problem, but we don't. So we try little things that work for us, and our mental and our own well-being and healing is essential on us in our children's recovery as well, or significant others too. So Kathleen, did you want to say something?
I did. I had a few people that some messaged me privately with questions, and some messaged the group. So I didn't realize I was listening to, and then looked down and saw questions. Since it's Thursday night, I'm here alone instead of with my team, so I apologize about that. But
Okay.
So I'll go ahead and ask you the questions. So we had two. The first one came in from Audra Stewart, and she said, here in Maine, we have police departments that are reluctant to carry and administer naloxone for fear of liability. Have you run into that in California or Pennsylvania?
Well, we, in the very beginning, our own police department had that very same statement. They said they didn't want the liability, that any EMT, fire department they could respond within 3 to 5 minutes, and that it wasn't their responsibility, and they did not want the liability. But as we started educating the community and the police departments, and it was kind of hard, because the police departments are one of those groups that don't like to be told what to do. And even if it's education, and we're telling them, I'll tell you what, when Narcan first came about, I didn't understand it enough, so I didn't back it up either. I thought it was an enabling drug. Even though it was an antidote for an overdose, I thought it was that. So our police department now is on board, and they do carry Narcan, and they have used it. So
Yeah,
to them, the whole dynamics of what the old police department is, and and what our communities are going through, they had to change. Like, there's nothing wrong with that change. Just it's
exactly.
okay. So
Yeah.
our police department now carries it.
Yeah, and ours here, we have, where I am specifically, my police department's about 40 miles from my house. So here we have our firemen and policemen and EMT all carry naloxone, thank goodness, because somebody, wouldn't be here by the time the police made it all the way here. But
Right.
we have had pushback from police, but I think as a whole, police departments are getting a lot better about understanding exactly what naloxone is, and agreeing to carry it. But we still do hear stories here and there of certain departments or certain locations that don't. So it's really a location by location based, approach to it. So hopefully more would be willing to carry it. And then also another question about liability in Pennsylvania. Um, you are immune, yeah, you are immune from liability for giving naloxone if you believe a person is suffering from an opioid overdose and you call 911. So here in Pennsylvania, you can actually, you can go into any pharmacy and purchase. We have a standing order through
Hmm.
our Dr. Levine. And anybody can go into any pharmacy. You can use your insurance or you can pay cash to buy to buy the naloxone. And there's so many different organizations that are giving it away for no cost. If anybody is ever in need of naloxone, please reach out and we will help you locate that naloxone and get it to you. If you can't afford to get it. So it's so important to have naloxone at home or Narcan at home. If
Right.
you have somebody, even if you have somebody at home that's taking a prescription for an opioid,
Right.
that, and you can, a lot of people have that misconception that if you're prescribed an opioid pill, you're not going to overdose. We know that overdose can happen with any opioid. And it's just so important to have Narcan on hand if you have somebody using. And then another question.
Let me just add to that right there. The law in California on calling in and helping somebody out, it's called the Good Samaritan Act, and that's what they call it here, where you
Yes.
aren't held liable to helping somebody. And but the problem is when somebody's um, like somebody's overdosing and it's not a parent that's on the other side, but it's one of their friends and stuff, they're reluctant to call. So that's what we're still trying to get across to, is the users to understand that number is to help,
Yeah.
and not to rat out anybody.
I know I did run into that issue a few years back. One of my boys overdosed, and thankfully we were able to revive him with Narcan and CPR. And he was in the ICU on a 24-hour fentanyl, or on a 24-hour drip because of the fentanyl. He was on the 24-hour Narcan drip. But when the police came to my house, instead of focusing on my son, they became very accusatory to me and not very friendly to me. Um, and told me that I could have charges pressed against me because this happened in my home. And I'm like, I don't do drugs. I've never done drugs. The drugs aren't for me. And I called 911 for help, and administered Narcan. And there's this thing called David's Law, and there's Act 132, and you cannot hold me liable for anything. But I'm like, why was he trying to intimidate me? So even though they have to carry that Narcan and come, it's you never know the response that you're going to get. It could be so different in the same department from one officer to the next.
Right.
So it's just knowing these laws and knowing that, they can't hold you liable is important too.
Right.
So,
Also, with the prescription drugs, a lot of prescribers are also prescribing naloxone as well with the opioids. So people are getting, two things. They're getting their opioids and they're getting a naloxone kit as
yeah,
well.
yes.
So,
Yeah, and a lot of places are starting to do that automatically. I've seen hospitals doing that.
yeah.
I have been requesting for more hospitals to do that in my local area. But so far they are not doing that here. And really, again, it depends on what area you live in. The approach is so different based on what area you're in. Some areas
Right.
like we're here where I am in Berks County, we're lucky we can just walk in the hospital with our child and say they need help and they get help. But I know if I went to a neighboring county, a parent there wouldn't be as lucky. So it's just so different every place. But yeah, it is. So yeah, I'm not sure in Maine what that Good Samaritan law would be. But in PA, we definitely have that.
And
Most
there's a lot
states
of,
do have it. Most states do have it now.
right, but a lot of people don't understand that law as well either. Even the doctors, even, sometimes you'll go in and talk to a doctor or something like that, and they don't understand, some people have never even heard of Narcan, doctors,
Yeah.
medical field.
Yeah. Mhm.
And or they've never heard of the Good Samaritan Act, or some of the things that we're doing on the street here, like all the boots on the ground.
Yeah.
Some of the professionals don't know. They haven't been educated, and I think people like you, Kathleen, is trying to push that out there. But like you said, you can only do a small area, and there should be a nationwide thing.
It should be. It should be. Yeah. And that's shocking. Because working in the medical field, Narcan has been something that's been, stocked in the med cabinets for like 30 years. So all
Right,
doctors should
right.
know what that is by now.
Right. But they
yeah,
don't. It's so weird to talk to. What is that? So
yeah, yeah,
you know.
absolutely. The other question that I had about fathers. So I know, like, even looking at our call, we have mostly females on the call, which are probably mostly moms, would be my guess, just
Mhm.
from working in this field and volunteering in this field for so many years. And we all know it is right. It's always seems to be the mom. So what can we do is there something in your perspective that we could do to help get dads more involved with this situation? What do you think, like, holdups there could be, that dads, not that they're not involved with their kids, because we know that they love their kids very much. We know that this is
Exactly.
hurting them emotionally. But what can we do to help to get more men or dads involved in advocating and
That's so tough. That's a very tough question, because you, like, I told people, they go, we need more dads, because we brought this question up before. I go, what do you want me to do? Drag them in? I go, it's
well,
but sometimes I'll tell people, go, hey, let's have food. Maybe that'll get the dads there, at a meeting or something like that. And
yeah,
once we talk to a father and we let them know, I'll tell parents to, yeah, have them call me and we'll talk. And once they do that, they take a breath of relief, because they actually go, oh, I thought I was the only one going through this. You see,
yeah,
in the very beginning, we all thought we were the only ones going through this in our families. 10 years ago, 15 years ago, I thought this was just my family doing it. I
mhm,
felt, what did I do wrong? What happened here? So, we got to try to break that, the stigma with the fathers, thinking that they, emotionally, they can cut loose in our groups like this, and they can talk and they can be a voice. And I start with coaching staffs. I like to go to youth leagues and stuff like that, and we talk to people. It isn't necessarily talking to the youth and young kids, or even adult, teenagers or high schoolers, about drugs. It's about self-esteem. It's about treating other people right. It's and a lot of coaches, because they have so many kids on teams, they have that stage. So a lot of people can, a lot of the males can get to their own kids like that. And once the kids understand that, then they bring it home and talk to their parents about it. In a good, what would I say, in the positive way, if a kid was to go home and talk about it. Not all kids do, but some of them do, because they're relieved about it. They're relieved about it. So getting fathers involved, that's why we do the public events and we go to these car shows and stuff like that, where, I say, like I said, it's putting boots on the ground. We don't just speak to, I like to make people not feel uncomfortable, but get to that uncomfortable crowd. The ones that are, don't really understand, because once you start talking about it, they go, oh, we know, we have somebody in our family that's going through this, and now we could, thank you. Now we could talk about it, and it's just a slow process, getting a father involved. So, but once they see other fathers in there, then they start feeling relaxed. But we all come together. I mean, even with the women and the men, it's just like we all come together here, and it's amazing to see a group of us, when we're all together like that, and we all, and it's just like, it's not a separate group. It's not moms over here and dads over here, like a junior high school dance. It's, everybody together trying to, come up with a common solution, or a common, antidote to try to, work with our kids. So yeah. I think one of the biggest things out there we have to do is education, or prevention through education, getting out there and talk to people, and I know it's hard because a lot of people don't, one of the biggest things out there of trying to put out public awareness is money, people being able to advertise, or to, print out flyers or posters, or, we even do bracelets and whatnot. And, we hand the stuff out, and it's a lot of it's free too. You can get a lot of stuff free through the CDC or even the DEA. They give out free, materials out there. I gotten a lot of stuff from all that, but some of the stuff I buy, and it's just putting that public awareness and letting people see it for themselves, but making it in an easy to read format. If I was to get a book that was going to tell me about addiction, like let's say even 4 pages of it, I'm not going to read but the first chapter, and then probably get tired of it, because it's just, it just starts dragging on. So I like to get, things that educate people. We have these small slide out cards that have 8 different drugs on there, from alcohol, tobacco to, opioids to, all these other things on there, marijuana, and they slide out. And it's just this little card. I should have brought some in here, but I didn't. And it's just, you put it in your purse, your wallet, your pocket, or your visor, and you're able to, read it at, whenever you feel like it. And it's just short sentences and paragraphs of, education that we have to put out there. So, dragging somebody out, it's just like, I always put myself, I tell people, like when I go speak in schools and stuff, I go, we have to make our format in 50 minutes. Obviously that's usually a classroom, time period. So we do it in 50 minutes, but I go, our talk is going to be about 30, and then 20 minutes for, whatever. And that includes a movie. We do projects. Where is that? There it is. This was made by a high school girl, and that we did a project for, and she designed that for us. And, we go out there, and she talked about mental health, vaping, suicide awareness. And we want the kids to be, some of this education has to be peer-based too. Instead of just, having an adult go in and talk to a kid all the time, but under the supervision of adults, but having the youth talk about it. So, we fund different programs for, our youth to put out there for our kids. We did 2 movies out there, one of them called Rewind, and the other one is called Poison. And it was 2, when I find it, I don't think there's a kid in high school that doesn't know that there's a drug issue going on on their campuses. I'm not saying 100%, but probably a good 80% of the kids know that something is going on out there, on the campuses. and they don't, not because they're using it, but because they see it. One of the big issues we had was we did a big symposium out here at the Ronald Reagan Library, and one of the biggest problems, you guys are going to laugh about this, one of the biggest problems the kids have on campuses about, the drug use and stuff, is that they lock up all the bathrooms on campus. Right, and it's go, what, they go, when are we going to unlock the bathrooms? And that floored the superintendents that were there, because they didn't realize the bathrooms were locked up, but their schools were doing it because people were going into the bathrooms and doing more than just smoking a joint or something like that. I'm not saying just, but I've seen people where they called me up and they said, yeah, we seen somebody in the bathroom, they were shooting up. And it's just like, what? So they lock down these bathrooms, and so kids are having physical problems because they're holding it in all day until they run home, and it's really weird. So there's repercussions from other people's, use of these drugs out there. So, yeah. So, so, and it's just ball wax. It just seems like, when we first started, we were talking about heroin. At the time it was like heroin hitting our community. Then it rolled into meth, and then it rolled, also heroin and prescription drugs. And then, things started going on. And then as we started going more deeper into it, we started looking at the underlying issues that we see out there, like I mentioned earlier, the mental health issues. I didn't get to finish that, but one of the kids in the high school said that one of the big issues is them trying to get into a university or a college, and them always having to take no breaks while they're trying to keep their grades up. And it was really hard on the students. So we tell them, let your kid be a kid and take a break. We tell parents, we even tell the kids, take a break, take a 20-minute break, go walk outside, go do something, go watch a little TV. The homework will be there, but you need a mental break sometimes than to just sit there and just hit the books all the time, especially when your friends are out doing things. So yeah, it's been definitely a ride that I know, that I've experienced. But with people like Kathleen and Paula, and I'm sure everybody else on here, all trying to do our best to change. We're all doing our best to make changes out there and to, bring awareness to our communities. That's all. I mean, that's all we can do.
Yeah.
And sometimes just not take no for an answer. We have a problem here. We are the parents speaking out. We are, the friends, the families. We are job holders, business owners. We are, we're voters. We're everything like everybody else, except that we have, substance use disorder conditions in our households.
Yeah.
But I've gotten, and Kathleen, you probably experienced this, being as a, a nurse, is, policemen. I gotten calls from mayors across the country, chiefs of police. I had a chief of police in Florida call me and said that she lost her son, to an overdose. Not even a badge or your education could keep their kids out of it.
Yes. Thank you.
So, and thank you everybody for being here. We can't do it alone. It takes us as a group to do all of this. And, I do believe in the village mentality. So, and our village is growing across the United States. So keep up the good work, everyone.